Our speaker today is Dr. Amir Hannan. Dr. Amir Hannan is a full-time GP and a CQC outstanding practice in Manchester. He is the chair of the West Pennine Local Medical Committee. He's the chair of the Association of Greater Manchester Local Medical Committees and chair of the World Health Innovation Summit. Developing a partnership of trust between patient, carer and clinician, his practice has enabled over 9,000 citizens, 71% of the total population, to see what their doctor or nurse has written about them, including free text as well as coded data, helping them to self-care, gain better understanding of their health and healthcare needs. The practice-based has a web portal which puts patients, carers, managers and clinicians at the heart of healthcare and helps drive change. Welcome, Dr. Amir. Can you hear me, Dr. Amir? Hello, Dr. Amir.
Can you hear me?
Yes,
Hello?
we can hear you now. Welcome.
Oh, thank you very much, and thank you for the invite to invite me to come along and share some of the ideas around real-time digital medicine and the partnership of trust. Is the PowerPoint available now? Have you changed over to me? Can you see? Hello, can you hear me?
Yes, we can see you. We can see your slides.
That's great. Okay, well, thanks very much. Okay, so I'd like to talk a little bit about myself. So I started as a GP back in 2000, and I remember about 3 years after I'd qualified as a GP, a patient was asked to come and see me. He was a Bangladeshi patient in his late 40s, early 50s. I don't quite remember exactly, but he had very poorly controlled diabetes, and the nurse had asked him to come and see me. Now, for those of you that don't know about diabetes, we do a blood test called the HbA1c, and it gives us some idea of what the control has been like over the past 3 months in terms of your blood sugar levels. And normal is if it's below 42 millimoles per mole or 6%. Someone who's well controlled usually has a HbA1c of under 53 millimoles per mole or 7%. But if you're poorly controlled, then it's above 58 millimoles per mole or 7.5%. So it gives you some idea of what normal, what well controlled and poorly controlled is like. So my opening gambit with him was to ask, well, how's your diabetes going? And his answer came back to me that completely flummoxed me, which I had no idea how to deal with. And in case you're wondering what was it that he said, his answer was very simple. It's fine. Now you might think, well, what's so difficult about an answer like that? Well, the reason is because his HbA1c, the computer was telling me, was 162 millimoles per mole, which is 17%. I didn't even know that people could have diabetes control as poor as that. I'd never seen it before I came to the practice. And yet his readings had been like that for the last, sort of 4 or 5 years. It has remained like that. And what I'd also seen was that he was coming in to see my staff, my nurses and doctors, who were increasing the medications and giving him more advice about how to control his diabetes. But what I could also see was that he'd never ordered a single prescription in the last 9 months. So he was coming in, seeing the doctor or nurse, walking out, not taking his medication, and as you can see, his control is very poor. But I had absolutely no idea how to actually help him to understand his diabetes and what he needs to do. Now, I'd like to just share some facts about where things are up to at the moment in the UK. And these are the latest figures that you can see. So you can see that adults aged 16 to 44, 99% of them have been online either daily or almost daily. And we're seeing that at the moment with the coronavirus threat, how many people are online checking things. The proportion of households that have got access to the internet is 93%. Number of adults using the internet weekly, 91%. So that's more than 9 in 10 people, adults, are at least online weekly. 87% are daily. And if we think about people who've gone online who are over 65 and they've gone online to do their shopping, so they've provided personal information such as their credit card details and things, then over 54% of them have done this. And if we think about another group, disabled people, 78% of them are recent internet users. And even amongst those over 75, where you might think, well, they're not likely to be using it, look at that, almost 50% of them are online. But if we then say, well, what about NHS services? And this is the latest information that we've got. This is from January. Then only 29% of the population is booking appointments online, ordering prescriptions online. Viewing medical records, only 8%, just over 8% are able to do that. And that's not even the whole record. That's just problems and coded data. And the percentage of patients who've at least used online services is 29%. And the question to ask is, if the rest of the world is using everything online, why are we so low when we're using online services? So I'd like to talk a little bit about this idea that I've got called real-time digital medicine, and what does that mean? And in a knowledge-driven healthcare system, we start with data. So let's imagine for a moment that you've got yourself a blood pressure machine, and lots of people are currently being invited, asked to buy blood pressure machines so that they can check them. Okay, well, you've got a blood pressure, and it gives you a reading. And the reading is, let's say, 170 over 115. That doesn't mean anything unless we provide some information to help you understand what normal is, what high is, and what low is. And if you link that information to the data, you get something called knowledge. So 170 over 115 is actually considered high blood pressure, and you need to do something about it. But of course, if all you do is just look at the information and think, oh, that's interesting, it's high, that's not going to be very helpful. So it's important that we don't just have the knowledge, but we also have the right skills. Have we checked the blood pressure when we're calm, sat down in a chair and relaxed with our sleeves rolled up? Or are we doing it just before we're about to give a big presentation, or after we've just done a big run? Clearly, you need to make sure that you've got the right skills to be able to do it right. And also have the right attitude, which is actually that's high, we need to do something about it. But you might argue, well, how do we get that blood pressure reading? Well, that means we need somewhere to go to, or we need a machine to have. We need to think about how often are we checking that blood pressure. NICE talks about checking the blood pressure twice a day for a week, and then averaging out the readings rather than just acting on one reading on its own. And then finally, what's the outcome that we're trying to achieve? And the outcome we might be trying to achieve is to bring our blood pressure down to a normal reading. But actually, very few patients of mine ever ask about trying to bring a blood pressure back to normal. What they're interested in is, doc, I don't want to die. I don't want a heart attack. I don't want a stroke. So starting to think about, well, what is the outcome that we're trying to achieve? And if the outcome we're trying to achieve is, I don't want a heart attack, I don't want a stroke, I don't want to die, then what's the processes that we need to go through? Checking your blood pressure twice a day for a week. Have we got a blood pressure reading? Have we got the right knowledge, skills, and attitudes? What knowledge do we need? What information do we need in order to get the data that we're collecting? And so in a knowledge-driven healthcare system, we're thinking about what data can we collect to achieve the outcome that we're trying to achieve, and what knowledge do we need to enable that to happen? And conversely, what outcome are we trying to achieve? What data do we need to achieve that? And it's that knowledge that saves lives, and that's what we need to think about. It's how do we get the knowledge that's going to help us work out what to do next? Now, in terms of that knowledge, skills, and attitudes, okay, sure, as clinicians, we need a certain amount of knowledge, skills, and attitudes, and it might be about immediate care, and we're thinking about this now as the coronavirus hits us around what information do we need as clinicians. But it's not just for us as clinicians. Patients and the public now need to do that, and that's why there's been this huge campaign to help people understand what the symptoms are, what to look out for, what do you need to do. We've seen there have been Public Health England, NHS England, and the politicians are now also talking about what's required. There's a big push going on in terms of research and science, in terms of what we can do. And it's not just about those who are critically ill, but it's also about thinking those who've got long-term conditions such as diabetes, heart disease, depression, etc. How can we prevent problems from happening in the first place? And there's lots of advice at the moment around coronavirus, around what to do to try and prevent problems. And that's really about washing your hands for 20 seconds regularly. And if you are going to cough, using a tissue, coughing into the tissue and then putting it in a bin. If you don't have a tissue, then coughing into your elbow, and trying as much as possible to prevent droplets. And then health promotion, which is really about saying, let's not wait for things to happen. What about making sure that we're not drinking excessively, that we're not smoking, that we're eating healthily and trying to lose weight and so on? And this is the knowledge, skills, and attitudes that all of us need for that. Okay, so let's just come back into my GP surgery. This is here I am with a patient in my consulting room. Now, the patients come along maybe because they're worried about something. Perhaps they're worried about back pain or something. Hopefully it's not about coronavirus, because if it is, they shouldn't be in the surgery sitting talking to us. So let's talk about, say, back pain. And if the patients come in, they've come to see the doctor, the nurse, the pharmacist, or whatever. And the reason they've come is because hopefully we know how to take a history, how to examine them, how to come up with a differential diagnosis, what the different possibilities might be for the causes of the back pain, what treatments there might be for it, what investigations we need to carry out. And that's what they're coming to ask us about. Of course, the other thing that they're also asking us about is what the local services might be like. What's the local hospital like? What's the local physiotherapy department like? And that's information that I've got locked up inside my head because other patients have told me the same. Of course, I can only do the best I can if the patient tells me as much about them as is relevant to them. So how long they've had the back pain for, what have they tried, what treatments have they had in the past, what investigations they've possibly had. And this is all information that they've got expertise on. Not only do they know about themselves, but also about their family and their work colleagues. So it might be that they're thinking about going on a holiday, and it's a walking holiday in the summer, and they're not sure whether they're going to be able to do that or not. And so that's information that only they've got that they can share with us. Of course, I might not know this person from Adam or Eve, but here's my clinical system in front of me. And when I put that person's name into the record, up comes the problems, the medications, previous consultations I've had with the patient, consultations that they've had with my colleagues, consultations that they've had with other people in the practice, letters from specialists from other hospitals that they've been to, or the physiotherapy department, or whatever it might be, investigations and test results. And all that information is on the clinical system. I might choose to go on to websites such as clinical knowledge summaries that might give me the latest advice in terms of how to manage back pain as well. And if I decide that I want to refer that patient on to the hospital, I might use something called e-referrals that throws up all the different appointments that are available in the different hospitals so that I can offer them to the patient. Now, those are things that I can see, but this is the exciting bit. If I can turn that screen around so that the screen can be seen by the patient as well as myself, then we move into a very, very exciting space. And I call that the partnership of trust, because I'm trusting the patient to tell me as much as they can about how the condition is affecting them and their family and their workplace. But they're expecting me as a clinician to provide the best that medicine can offer. And if we can turn that screen around so that the information is shared between us, then we move into this very, very exciting space where lots of exciting things can happen. And that's what I'd like to share with you. So what is it that patients can do? Well, here are some screenshots from the Evergreen Life PHR app, and this one's from the Patient Access app. And what they can do is they can order repeat prescriptions online, they can book appointments online, they can see consultations. So as soon as the patient walks out of the door and I hit the file button, they can actually see what I've written down in terms of the history, the examination, the plan of action. And remember that patients can only remember about 10% of what the doctor or nurse has said to them as soon as they walk out the door, or only about 3 bits of information. So that might be, please take this tablet, please come back and see me in a month's time, and you need to take the tablet once a day, or whatever it might be. They may not remember any more than that, but if they can read what you've written, how exciting would that be? They can see letters. So when the hospital have sent letters back, instead of constantly ringing the surgery to say the letter's back, or booking an appointment to see us to see what the letter has said, they can just go online, see the letters as soon as they've arrived in the GP surgery, and read it for themselves. If they're having blood tests done, instead of ringing up the surgery to check if the blood results are back or not, they can have the blood test in the morning, and then that evening or over the next few days go online and look at the test results. And you can see a screenshot here from Patient Access that shows not just the test result, but also shows what the result is and whether it's abnormal or normal. And finally, they can not only view their records and send messages, but they can do something called proxy access, which means that if you are granted access to your children's records or to your parents' records because they can't go online, you can then switch user by clicking here, choose that person's name, and then view their medical records on their behalf, order their repeat prescriptions, or book appointments for them as well. And these are some of the things that the apps can do here and now and are available for GP practices to offer if they're offering it for them. Some of you may well have heard of the NHS app, and this is what the NHS app looks like, where all the things I've just described are also visible and available for you to use using the NHS app. And here is the new Evergreen Life app. And this is more of a wellness app rather than a disease app. So if you click on GP, you can then do all the things that I've just described. But you can also monitor your fitness levels, you can look at your food, and you can also measure your happiness level. And this got a lot of gamification here, so you can see that this is like a pie chart. And you can see, for instance, that this particular person is a very happy person, but they're not particularly fit, and they're generally eating food generally better. And that provides them with a wellness score. And the whole idea of this is that when you log in, you look at that, you think, right, I'm not very fit at the moment, so maybe I need to do something around improving my fitness levels. And by doing a couple of little things like that, maybe I can nudge myself and improve my wellness score slightly. In terms of the happiness scores, how did they do that? Well, when they click on the happiness score, it asks them to complete a series of questions. And based on those questions, they're given a score, and that score helps them to see how happy they are and see if they can improve things for themselves. Not only are they given that score, but it also then provides them with information on what else they might be able to do to try to improve their happiness levels as well. And I think this is a really exciting way of looking at things, which is not just about the GP surgery, but also about your own health and well-being. And then the other thing that many of us are now doing is sending text messages to patients using AccuRx for those practices that are using EMS Web. And this is a typical sort of text message where you can send information to a patient, including a link. This is the text message that we're sending our patients to inform them about coronavirus and what they can do for themselves. It's a really simple way of being able to keep people informed about what's going on without having to see the patient directly. Okay, so that's great. We've been doing this, but there are problems surely with letting people do this. And here are some of the issues that people have said. They've said, well, why bother letting patients view the records? Because they just won't understand it. What about data that other people have provided that they shouldn't be able to see? Or there might be data in the record that might actually upset them and make them feel even more upset because we haven't provided it for them and just allowed them to go online and look at it themselves. There's the fear of litigation, that patients might be able to find out about things that we've forgotten or missed, and then they might sue us. We just don't have the time, the money, or the resources to start telling people to go online and do these things. What about those who are really worried? We're just giving them ammo to give them more information because they'll see a slight abnormality in their blood test result, and then they'll become worried about it. Or they might just start demanding more and more and more if we offer services online, and we just won't be able to cope. Or we've got so many other priorities that are expected of us from NHS England, from the CCG, from the Manchester Standards and so on, that we just can't add this on top of everything else that we're doing. Or, well, I'm just a locum, I'm a salaried doctor, I'm a nurse, or I'm just a patient. You know, why are you even telling me any of these things? I can't enact this. This is for the partners in the GP surgery to do. I can't do it. Or the doctors, the GPs are turning around saying, well, we don't really know how to do this. So how can we start offering it when we don't know how? Or actually, we need everybody in the practice to believe this is the right thing we do before we actually start doing it. Or people are going to be making decisions without having the experience themselves on how to do it. And that's really that the people that have decided how to do these things and what they're saying are important haven't done it themselves, and so don't really know what's important and what isn't. What about if people find errors in the records? Who's going to fix them? And then it's, well, surely this is an action for NHS England and the people at the very top of the system to be doing. Shouldn't we be waiting for them rather than us trying to take charge and do things at a local level? And then, well, actually, if it's all about passwords and PIN numbers, well, that's got nothing to do with us as doctors and nurses. That's something for the receptionists to do and deal with. My job is to just fix people's backs or whatever it might be. So those are all the kind of issues that people have come across, that I've come across, people saying why they're not doing it or what it might be. So let me just describe where we are up to. We started back in 2004 to give patients full access to the medical records, and here's my latest data as of today. And what you can see here is that we've got patients from 0 age to 90 plus who've got access to their records. We've currently got a patient who's 100 years old, and our oldest patient is 103 years old who's got access to the records. Now, clearly in that circumstance, it's not necessarily them accessing the records, but it might be their children who are doing it, who might be in their 70s or 80s, or younger, even their grandchildren who are doing it, or their great-grandchildren. But you've got some idea here of lots of different people, particularly in the age group of between 25 and 75. That seems to be the majority of people that are doing it. Here's another way of looking at the same data, and you can see that overall, 71% of our 13,039 patients have got full access to the medical records the way I've described. That's 9,356 patients. But if we look at specific conditions, if you've got diabetes, it's 74%. If you've got type 1 diabetes, insulin-dependent diabetes, it's 90%. If you've got cancer, scary diagnosis, 70% of them have got access. If you've got anxiety or depression, look at that. 4,027 of our 13,000 have got that code in their record. So at some point in their life, they've been diagnosed with this by their doctor or nurse. And yet 78% of them have got full access to the medical records. It's almost as if they're managing their anxiety by being able to see the information that's recorded in their records and getting a better understanding of their diabetes, their heart disease, or whatever. 67% of our patients with heart disease, 84% of our patients who've been registered as carers, 97% of all our pregnant women. Currently, we've got 113 pregnant women and 110 of them have got full access. Look at this, people with learning disability, those who shouldn't really be able to do this, and yet 62% of them have got full access. Now, clearly that's because we've activated the carers in the majority to be able to care for them even better. What about those who don't speak a word of English? Well, we've got a very large Bengali population, 1,549, and look at that, 84% of them, 1,313 of them have got full access to their medical records and they're using it. Patients with asthma, COPD, patients who are ordering prescriptions online. Overall, we've got two sites. We've got the Horton Vale Surgery and the Thornley House Medical Centre. At Horton Vale, overall, we've got 61%. And Thornley House, which is where I am based, and I work as a full-time GP, 9 sessions a week, 80% of the patients have got full access. If a patient walks into my surgery, if a patient contacts me and I phone them over the telephone, or they send messages online, I am making certain not only that they've signed up for access to their records, but also that they know how to use it. And how do they do this? Well, we've got the practice website, hcmc.co.uk, and I encourage you to look at the website and look at the information that we're providing on there for you. And you'll see over here our mission statement. There for you all your life, your good health with our support, empowering you to live well. It's a really important point that we're making, that it's your diabetes, it's your heart disease, it's your depression. We are here to support you, not to try and fix you. And down at the bottom, if you click on register now, you come to our explicit consent process. And here's a little video that you can watch that explains what it is that you need to do. You need to get your PIN numbers, which you can collect from the front desk or have it emailed to you. And currently, as a result of the coronavirus risks, we really want people not to come into GP surgery. So as much as possible, it's safer to just provide your email address and be emailed over to yourself. But although we want everyone to have full access to the medical records, we also have a responsibility to ensure that it's safe for patients to do so. And so we put patients through a test. And this is the Records Access and Understanding Safety Checklist questionnaire. Now, before we're going to put people through a test, if people want to know more about, well, what is it that we're doing, we've provided lots of information on the webpage around what is it about. There's YouTube videos that you can watch. There's an example health record that you can try out. You can find out what the benefits and challenges are, how to keep your information safe, how to maintain confidentiality, frequently asked questions. What about blood test results that you won't understand or you may not understand? How do we build a partnership of trust? So this was a blog that was done by the King's Fund. What does the BBC News say about it? An interview I had with BBC Radio, so that it's not something that I'm doing quietly in my own GP surgery, but actually engaging other people with. What about the guidance that the Royal College of GPs has produced for health professionals on enabling the full access to the medical records? All this information is already there for you. here are the limits of health data as well, and why it's important that you also provide information yourself about and collect data yourself, such as how many steps you're walking, or measuring your own weight that's over and above what the GP surgery might have. So there's lots of useful information. But once you've decided you want access to your records, we then put you through a test. And here's an example of a question. There may be an instance when accessing your medical records online, you may read some information that could be shocking or upsetting. What do you do if this happens and you can't speak to your doctor or nurse immediately? And you have a series of choices that you have to make. You could either choose not to view the test results, but wait until you've seen the doctor or nurse, panic and get worked up, look at some of the recommended web pages about self-care on the practice website, wait and contact the practice next working day, contact 111, contact the out-of-hours service, or go to casualty. And you have to pick a choice. And if you choose wait and contact the practice next working day, that seems quite reasonable. But if you choose panic and get worked up, well, then that triggers a conversation with the practice so that we can have a chat about it and advise you that perhaps it's not a good idea to look at your record on a Friday night, knowing that the GP surgery is going to be closed at the weekend, but perhaps look at your record first thing in the morning, let's say about 7:30 before the surgery opens, because then if you do read something you're panicking about, then you can get back in touch with the surgery. Now, we asked people on this webinar to complete a questionnaire to see what answers there are. So could I just ask Shanaz if you could switch over and show us what the results of the questionnaire are and what people, how real people have responded. Okay, so.
Can you see the slides, Dr. Amir?
Yes, I can do. Thanks very much. Are you able, do you want me to talk it through, or are you going to respond?
No, please talk it through. Thank you. Thank you.
Okay, all right. So you can see here that we've got 31 replies back, and 30 out of 31, they've done it themselves. Someone's done it on behalf of somebody else. Okay, if you keep going down, we can see that all of them have been done by people who speak English, and that's important because the questionnaire was done in English, so that we know we're getting proper consent. Keep going. About half the respondents have already registered for online. So even on this webinar, even though they've got online services, about half haven't. And that's interesting to note. Okay. The way the system works is you have to put passwords into the app. It's not two-factor authentication. And yet look at this, that 96%, 97% have said yes, they're happy to use passwords to log into the records with. Okay. And we can see here that 94% are happy to be able to view their records, but interesting, 2 people aren't and don't think it's a good idea to view their records. And we recognize that this isn't a magic bullet for everybody. Those that don't do it, by the way, they need to think about how they're going to manage their care otherwise. It's good to see that more than half have said they'd like to feedback, because how else are we going to improve things unless we give feedback? And it's important that people do that. And if they see a letter in the record and it's about somebody else, it's good to see that 97% would contact the practice. Interestingly, one would say no, they wouldn't contact the practice, and that's not very helpful because it means that it stays in the record and isn't passed on to the correct record, and so it might mean that someone might be missing out on the care they need. So we want people not to stay quiet, but to tell us. Okay, and then if they did see something that was potentially upsetting and they couldn't speak to the doctor or nurse immediately, you can see here that about 48% would wait and contact the practice. A small number wouldn't view their test results, but wait and speak to the doctor. 7% would panic and get worked up, and I've explained that if you're a panicky sort of person, then the answer is probably to look at your record just before the surgery opens. If that's still not good enough, then it might be that it's appropriate to say that actually it's not for you. Some would look at their website, some would contact 111. It's good to see that nobody would go to A&E, and that's really important. Interestingly, my own findings are that many people under 30 would choose to go to A&E, and we don't want them to do that. Would it upset if you read something somebody else said about you with regards to your health? And we can see here that about 30% would say no, and about 30% said don't know. But there's a couple here said, yes, I don't want this information kept in my record, or yes, this could destroy our relationship. Now, this doesn't happen very often where someone else is speaking about you. But if you did come across something where someone else says something about you, then get back in touch with the GP surgery and speak to one of the doctors. That usually resolves most people, and in 15 years, we've never had a problem with this, even though people worry about third-party data. People do talk about redacting records and things, but actually, there could be people in A&E now writing information into the record that includes third-party data that we haven't redacted. So it's not a very practical way of sorting things out. And finally, do you feel you understand that? It's interesting to see that 29 out of the 31 said yes, but 2 people still didn't. And again, it would be an explanation to say, well, we've just had a chat with you. I've written in the records the summary of what's been said. You'd be able to see that. You'd be able to see test results and things. And again, patients would be able to understand that. Thank you very much for that, Shanaz. Can you just switch over back to me again? Thank you very much. Okay, so if we look at the practice website again, and then if we click on the main website, then this is where the honey lies. And you can see a lovely quote here from Nelson Mandela. Education is the most powerful weapon which you can use to change the world. And boy, how important is that now at the moment, given that there are no specific treatments for coronavirus. So the only thing that we can really do is educate people about how they can look after themselves. It's not even get an appointment with the doctor to be able to fix you. And so this practice website that we've got down the left-hand side, we've provided information. We've provided information, and I call this a patient control panel. So you can log into your medical record, but there are trusted websites that you can go to. So we do not recommend Dr. Google. And it's not surprising that on the line where it says education is the most powerful weapon, you can also see directly the link to clinical knowledge summaries. But you've got common problems you can solve, and that's many of the minor ailments, the top 50 things that people come to the GP with where they don't need to come. So if you click on that, you'll find out more there. There's Health A to Z, there's NHS Choices, there's Health Unlocked, patient.co.uk, and so on. So this is the depression care page. So this is what I direct our patients to who are suffering with depression. And what you can see over here is leaflets that they can download, audio and video, to help them understand how to manage things like stress, depression, anxiety, sleep problems. This is going to be very, very relevant given that there's going to be a heightened sense of anxiety amongst people suffering, worrying about coronavirus and what they're seeing. You can see here facts that help to reassure people that actually they're not alone when they're feeling mental illness, because it's incredibly common. And here are common reasons why, what can trigger them. And notice how social isolation is one of the factors that we're actively encouraging people to do, but that could actually lead to an increase in anxiety. Again, if people are warned about this and aware of it, they're more likely to then be able to accept it and understand what to do, and then start to learn about what they can do for themselves. Here are the top 10 things that people can do to look after their own mental illness. And again, it's very visual for people to see, to talk about their feelings, keep active, even if you're socially isolating yourself at the moment, drink sensibly, do something you're good at, care for others, send messages out to help people. We've all been doing that at the moment in terms of helping people. If you are feeling stressed, look at the NHS Choices information there, or Mood Juice. And down here, there's I can't be bothered to do anything, and various other other things like top 10 things you can do to help make yourself feel more happier. And further down, there are apps that you can download, including Headspace and Calm, which are free for a week to use. And after that, there's a small payment to be used. And again, these are all things that you can do to try and help get yourself better. And there's the link to that web page if you want to see the information that we're providing. But you can also see that whilst patients with depression are looking at their records, they're also got lots of other links to other things that they might also want to see that might be able to help them as well. Okay, so what is our process? Well, we assume that all patients and carers can have full access to their medical records unless there's a good reason not to. We've engaged our patient participation group to ensure that to use them as guinea pigs so that they can try it out first, tell us what they think, feed back to us in terms of what the processes are, as we then roll it out to everybody else. It's really important that we try to inform people rather than just put a website or a link. And so in the GP surgery, when I'm consulting, whether I'm over the telephone or face-to-face, is asking them, so have you got a smartphone? Would you like access to your records? Informing them in it, explaining why it's beneficial, because all the things that we've just talked about, they'll be able to then read afterwards and share with their families and understand it better, so they're not trying to remember everything. And then activate them in the consulting room by actually doing the questionnaire there and then, rather than just sending it out and expecting them to do it on their own. If you do the questionnaire, it literally takes about 2 minutes, and it means that they're then over the line, they've got the access to their records. To get the full records access and understanding, they have to complete the safety checklist questionnaire that we've talked about. It's, again, a good idea to do it with the patient there and then, because then you can resolve any questions that they might have, rather than them doing it at a separate time and then you having to chase them up. It's been really difficult to chase people up afterwards, which is why I've ended up incorporating it into the actual consultation itself. Once the questionnaire has been done, we go through the medical record to check if there's any reason, any good reason not to share the information. Now, we're not reading every word of every line because that would be impossible to do. But you do get a feel as a GP when you're looking at the record about whether there are any issues that there might be in there. And I'll come back to what those sorts of issues might be that might make you want to just woke for a moment or think a little bit more carefully about whether you should have access to the records. If you've deemed that it's safe for them to do so, and that's for the vast majority of patients, then I put a code in that says patient remote record access enabled as an active problem list. And that's because when I'm looking at the summary information when the patient first rings me, what I'm also looking for is, have they already got full access to their medical records? If they have, I can just check that they're reading it and using it. If they have and they haven't, because they've forgotten their passwords, I can reset their passwords for them. If they haven't got it, then again, it's an opportunity for me to inform, engage, and activate them and do the questionnaire. And that's what I've been doing for the last 15 years. Once we've done that, we then have to switch on all the subcomponents, and that's a back office function that we have to do in order to switch on the access. We then send a text message to the patient informing them that they've got the full access to the medical records and also helping them to understand what it means. We then email their PIN numbers to them if they haven't got it immediately, if they're not there in front of me. And then we inform them that they can email the practice if they've got any issues with regard to the online services, rather than ringing up the surgery and hogging the telephone line, and then we can then get back in touch with them. And then every Sunday, we publish our data on the practice website, and you can see that over here, where we've got the latest data. So you can always see how things are. And again, that's our way of showing patients that they're not the only people doing it. Now then, where are the problems? Well, the main exclusion criteria clearly is if a patient can't give consent because the requirement is for them to complete a questionnaire. So patients who've got dementia are not going to be able to do this. People that are forgetful, as long as they're able to give consent, can still go ahead and do it. And I've often ended up consenting people in that process. And of course, it's my way of checking whether they've understood the information and been able to give consent or not. The second group are those who've not got the internet at all, the digital divide. But of course, if they've got families or carers who can help them, they might be able to do it for them. So just because they haven't got the internet doesn't mean they can't have it. But there are a small group of people who have no family, no carers, and no internet at all, which is unfortunate. And again, it's going to be very difficult for them to be able to do this. And then there's the practices themselves, really, who are turning around and saying, well, we just don't have the time and the resources to devote to this. And it's very hard. If a practice says we don't want to do it, well, it's just not going to be possible. So you're going to have to create some time and resources to be able to do this, either in hours, or in my case, which a lot of the work I've done has been out of hours, evenings and weekends, because the surgery is so busy. A lot of my colleagues think I'm crazy for doing that, but look at the fact that the impact it's had now and what we're doing as a result of investing that time in doing this. And what I would recommend is that any practice wanting to do this, even if it's only for 1 or 2 patients, even if it's only 10 or 15 minutes to do 1 or 2 questionnaires, start thinking about doing it. And then finally, there's the patients who go, I'm just not interested. Now, I put that in brackets because I've been doing this for 15 years, I've kept encouraging people to sign up. And the marketing guys will tell you that if you tell someone something 5 times, by the 5th time, they'll usually take it on board. So just because someone says lack of interest does not mean they won't do it. It just means they're not ready for it at the moment, for most people. Of course, if someone clearly says, I really, really do not want to do this, then just make a note of it and don't keep hassling them, because that's not going to be helpful for you or for them. What about the problem areas? Well, one of the problem areas is those with severe mental illness. Now, that's not the person with a little bit of anxiety or feeling low, because, say, for instance, for coronavirus. What we're talking about here is those with schizophrenia, those under secondary care mental health, but even and personality disordered. Now, even in that group of people, I've put this as a problem area and not an exclusion, because what I do with them is I write, if the patient does the questionnaire and you feel as though they are able to answer the questions and understand them, I'll write to the consultant psychiatrist and say, this person has asked for full access to their medical records. Would they be happy for me to do so? And again, that's important, because if they read something in the record and it affects their mental illness, it's important for the CPN and the consultants to know this. Our local psychiatrists have been very supportive, and all of them have written back letters saying, yes, they're happy for us to do so, or in certain circumstances, advised against it because they didn't feel it was in the patient's best interests. And remember, as data controllers, we as GPs determine whether patients can have access or not. The other major problem area has been child protection. Two different situations here. One is where someone is actively under child protection, and that's been a real problem. At the moment, I'm still really awaiting guidance on this. I think it'd be safe to say at the moment that I'm not giving someone under child protection full access because of the potential sensitivities and risks. And that's because our first priority is not just to give access, but also to make it safe for that patient, and anything that makes it unsafe, we shouldn't do. So for the moment, child protection. The other problem is someone who's been under child protection as a child, for instance, when they're 6, 7 years of age. But of course, 15 years down the line, they're now 22 or 23 years of age, and they'd like access to the medical records. Again, it's a little bit of a grey area there, because they may not still be under child protection, but there may be issues in there that have never been shared with the patient. And again, it's a grey area. We can now cut off those letters and stop the patient from seeing them. And that might be a way around it, and explain to the patient that we are giving you access because we want you to understand your asthma, your diabetes, or your depression, but we're not going to share the information around child protection because of sensitivities around that, and leave it as that. We've not had any problems as a result of that. Hello? Hello? Yeah, can you hear me now? All right. I don't know what's happened. Yeah. Okay, I'll keep going. Okay. All right. Thanks. So that's child protection. We've introduced a new thing called Engage Consult, which is a new way of doing electronic consultations. And we send them a text message saying, would they like to register for this? And then they can choose a medical problem. They can decide on who they want to see, and then what the problem is: chest infection, urinary tract infection, or whatever. So they click on request for help from surgery. They're then asked to complete a series of questions, and there's a warning about if it's an emergency, this isn't appropriate. And then they're asked a series of questions, and this is the sort of a typical sort of question. It takes about 5 to 10 minutes to complete the question. They can skip questions and they can finish whenever they want to, but ideally we want them to answer as many questions as possible. And then this is the output that comes from Engage Consult, and it gives you an idea of the sort of information that's available. A very, very comprehensive medical history. That medical history often helps us with the diagnosis. 90% of the diagnosis is made on the history, and that's why we've introduced Engage Consult, because if we can get as much information as possible, then as a doctor or nurse, we can look at that information and often decide there and then whether we can treat it or whether we need to do anything different about it. And then the third thing that we've introduced is something called MJOG Messenger. This is very brand new. It allows you to send messages to patients, but the message is in the form of a text. It includes videos, and this is a talk I did last week on coronavirus that you can watch. But because it lands like that, it's much, much easier to see what the information is. You can also see that MJOG are also sending reminders to patients. And because it's an app on the phone, it comes up as a notification that you can see. So it's a much tidier way of sending the information to someone rather than just sending them a text message. So what's been our response to the fear of coronavirus? And also thinking about that patient with diabetes who I saw in 2004, what would I do if I saw that patient today? Well, I'd ask them for access to their medical records and also proxy access for their children and parents if they're not able to do so. I'd be encouraging them to start recording their wellness scores now. And again, you know, if you are an anxious sort of person, then you know, start recording your scores. You can use Evergreen Live PHR. You can download it from the App Store or the Google Play Store and start recording your own happiness levels. You can get your PIN numbers from the GP surgery and then start using online services. We've got the information on the practice website, and this is the latest information we've got on coronavirus that's on our homepage. We've posted messages on our Facebook page, so there's our Facebook and Twitter page, and you can see here Twitter. So again, we're using social media to try and get messages out to people as quickly as possible. We're using Engage Consult so that they can send questionnaires in for us that we can see. And I've had patients completing questionnaires over the weekend now that we will then deal with tomorrow. We've got MGOG Messenger that we're rolling out to patients so that they can see the information and help them understand it. And finally, here's a picture of me in the consulting room taking the AcuRx video consultation so people can see that too. So this is a perspective of real-time digital medicine taken from a patient. This is in 2007. This is 13 years ago. I'm 30-something, working mother, looking after a small child, a part-time job, a husband, a house. The list goes on and on. I also have diabetes and underactive thyroid, fertility problems, suffer with depression, asthma, and recently started with medication to support my kidneys. I simply don't have time to be ill. She was introduced to online access to records, and it completely changed things because she felt she was taking a positive step towards maintaining a healthy life, understanding her medical needs, and doing it all on her time when it's convenient for her. And she felt in 2007, it's the only right that she should be able to do this online. Well, I would say if that was right in 2007, it's even more important in 2020. And finally, for those of you thinking, what's the point? We're only going to be able to do a couple of people. Well, the starfish story is such an important one. An old man was walking on the beach one morning after a storm. In the distance, he could see someone moving like a dancer. As he came closer, he saw that it was a young woman picking up starfish and gently throwing them into the ocean. Young lady, what are you throwing starfish into the ocean for? The sun's up and the tide is coming out, and if I don't throw them in, they'll die, she said. But young lady, do you not realize that there are many miles of beach and thousands of starfish? You cannot make a difference. The young woman listened politely, then bent down and picked up another starfish and threw it into the sea. It made a difference for that one. Thank you very much.
Jazakallah khair, Dr. Hannan, for that really insightful talk. MashaAllah, there was a lot to think about, and it was very, I'm sure it was very difficult to condense 15 years of experience into one PowerPoint. Just to let you know, Sister Shanaz had problems with the audio, so I'm stepping in now. Alhamdulillah, it looks like it went really well. Jazakallah khair. We do have a few questions, if that's okay. So the first question we have is somebody who's asked, what about safeguarding issues, for example, domestic violence cases? So I presume that you're going to have the same kind of cautions that you would have in a child safeguarding case, but how would you respond to that?
To identify a safeguarding issue, you have to immediately, like domestic violence or whatever, you have to activate your safeguarding policies. This is not about records access, so you immediately activate your safeguarding policy and make it safe for the individual. And that might mean contacting social services, ringing the hospital and so on. And then as a safety measure, switching off the records access as soon as possible. The important thing is that we need to be vigilant towards it.
Jazakallah khair, thank you. Yeah, Jazakallah khair, thank you. The next question we have is somebody who's asked, what about hacking? So are you worried about people getting into other people's personal information? So is that our responsibility or theirs?
So that's a great question. So as part of this shared decision-making process, the question that I ask patients is, what's more important, your reputation or your life? If your reputation is more important than your life, then it's possible that having access to your records might not be the right thing for you. Especially if this might be something in your medical record that you really wouldn't want anybody else to ever find out under any circumstances. Now that's very rare in my experience. Very few people are in that situation. Most people are more bothered about making sure they can do everything to help themselves to prevent problems with diabetes, heart disease, and so on. And remember, with coronavirus, this is even more important. So if your life is more important, then I would argue that it's probably safer for you to have access to your records, but then be very careful with your passwords. Don't leave them under the keyboard or for other people to look at. Make sure it's a secure password and not something that people can easily guess and those sorts of things. But that's why this is a consent process, and the patient themselves has to decide what's important, their reputation or their life.
Jazakallah khair. Excellent answer. So we have two more questions. The first one is, are there recommended processes to support patients with disabilities or difficulties, physical and learning, to access and understand their own records rather than through carers? So somebody who's kind of not part of the family here, carry on.
Yeah, I believe that in the sort of 80-20 rule, although it's more looking like 90-10 rule, which is saying that the majority of people who can do this should be able to do it. But there will be some people for whom it may be too difficult, too dangerous, and as I've said, there are some exclusion criteria as well. But if the majority of us can do the things that I'm describing, and they're not ringing up the surgery to find out their test results and things, then that frees up my time to be able to devote to those people that can't. And I think we need to take that more holistic view that says, let's try and help those people that can, the low-lying fruit, the ones who are relatively easy to do, and frees us up for those that can't.
That's perfect, Jazakallah khair. We have 2 more questions. Nobody's raised their hands yet, but I think what we'll do is we'll go through these 2 questions, and then because of time restraints, if anybody has any further questions, if you can just still put them in the chat box and then put down your email address, and then inshallah we'll get back to you after we've spoken to Dr. Hannan. So the next question is, I was wondering whether you would look at the Evergreen app, so the Evergreen app with the patient in the appointment, in the consultation.
Yeah, when the surgery went down, when the IT systems in the surgery went down and we weren't able to access EMIS Web at all, we were actively saying to patients that can you log into your record, because that was working through the 4G network. And I call that the 4th emergency service. So the patients themselves are bringing the information. This is going to become even more relevant with coronavirus. And I'm also aware that Evergreen Life are about to launch a new service whereby patients could present in A&E, they could share their record to the A&E doctors. The A&E doctors can see the full GP record if it's been enabled, so they would be able to safely write what medications they've prescribed onto the Evergreen app, and then that information would come back to the GP surgery at a later date so we can update it. And it's an example of how we're using the patients to be able to safely manage patients in the community. And it's a patient that makes the information available to the clinician wherever they may be, anywhere in the world.
Excellent, sounds brilliant, Jazakallah khair. And then the final question we have here is it true that GPs are legally obliged to provide records to patients by April this year, for example, blind patients?
So the GP contract requires that GPs have to enable the online services, and that's for coded data currently. So that's your problems, medications, allergies, test results. It's not the free text. It's not what your doctor or nurse has written about you. And that's why I think it's better for us to think about how we can enable the full access with the consent processes, which I think keeps us safe, and it's also safer for the patient too.
Excellent, Jazakallah khair. So thank you for that insightful talk once again. Very mashallah, brilliant talk, mashallah. And I appreciate you taking time out, mashallah. All our speakers, they sacrifice their Sunday morning for us free of charge. We don't give them anything in return. So Jazakallah khair. Please make dua for Dr. Hannan. What I'll do now is, inshallah, I would be really grateful if you could. Sorry, is there any last words?
Are any GP practices watching this and who are interested in wanting to know more and would like further support and help, then please get in touch with me, either through the Twitter account or contact BEMA directly through their email, because I'm keen to try and support practices to get started. So if anyone would like to know more beyond this presentation, then please get in touch.